Okay, so Sean, two finger breaths, posterior to the anterior superior spine. There's a bump underneath the hip. I mark a boundary that is about 2 centimeters from the edge of the prep with his blue dots, so I recognize when I'm getting close to getting into unsterile territory. Of course, we have the bump underneath the hip. I'll feel the crest, walk towards the inner table, feel it fall off, outer table. Usually a flat spot in the middle. I usually aim a little distally. Now she was really easy, that just fell in. It doesn't usually work that way. Should be nice and solid. And this isn't, don't expect it to be like this. This is, you know, the video that makes it look easy. It's not always. So what I would do, so I always go in 5 cc increments. That way you don't overly activate the stem cells. You don't want to suck on it and pull super hard. If you're not getting anything at first, try fracking it. It usually gets a little bloody here just from the skin and everything. So I'll just keep that little sponge there. If you're having a hard time getting a draw, my usual routine will be to frack it first, once or twice. If that doesn't work, then I just re-drill it in a different spot. And sometimes it's amazing what a few millimeters difference will do. If you fall off the crest, don't worry, nothing bad happens. That's happened to me a bunch of times. People won't even notice it. And I used to use a steri strip on this, just so I didn't want to take sutures out. Wade uses sutures. I stopped doing that because I had people who bled through their dressing and had to come back. And she's a little juicy here. So you should take a pretty good bite. You don't usually bleed quite this much. Then I'll usually, if I'm with someone that I'm gonna see back in the office, I'm doing an outpatient, I'll usually put a subcuticular stitch in, like a knee or a shoulder, and then take these stitches out at follow-up, which is usually 3 days later, and I just steri strip it. It stays together fine.
Hey, while you're at it,
and then the dressing I usually use is just a 4x4 quadruple. Should clean this up a little bit. You can see my warning track a little bit better here. This lets me know when I'm getting close. And the tegaderm. Tegaderm gets static electricity on it. And so if you go slowly, it'll actually cause your bandage, your 4x4 to jump up. So I sort of aim it up and then push it down quick. And then the bump comes out. So she's probably rotated about 30 degrees. It takes the fatty tissue away and it makes the crust more prominent.